the primary public health sector here pays a lot of emphasis in making sure that as many children and families are protected from especially childhood illnesses, and immunization is key in that role. Yeah. But there's so many people in my country, that even in the city where I live, who can't access vaccines for a lot of reasons. One is just even just taxi fare or transportation to get to a public health facility. So you're really looking at a lot of challenges, just accessing the public health facilities, but also a big challenge is also the cost. When you get to the hospital, there's usually a fee to do that. And if it's not a national campaign, or if a child is behind with other immunizations, you'll be asked, for instance, to pay. And sometimes that can be a very stumbling block, especially in a country where unemployment is very high, and there's a high income disparities amongst others. The other is also for a lot of moms is just having documents, like having a birth certificate or a national ID for you as a mom, but also a birth certificate for your child. Sometimes those have been also challenges for a mother to take their child to hospital, because obviously when you get to a public health facility, there needs to be some records. And so if you don't have a birth certificate of a child, it becomes very difficult for you to get to the hospital, because that needs to be recorded.
I'm Ambassador John Lange. I'm a senior fellow for global health diplomacy at the United Nations Foundation. You all know the importance of vaccinations. And you can just look at what has happened when people have been vaccinated and the big successes that has generated. When the World Health Assembly in the year 1988 decided to eradicate polio, there were 350,000 cases a year. Last year, 2020, there were 140. And this year, there are just a very small number of cases. For measles, 23 million deaths have been averted through the measles vaccine since the year 2000. And you look at the current concern of all of us, COVID-19, and you can see that high levels of vaccinations have resulted in great drops in the number of people dying from COVID in the countries that have been able to implement those vaccinations to a large number of their people. And what we need to do now is to respond to the pandemic that currently exists, prepare for future pandemics, and very importantly, continue and build up immunization programs and other global health programs so that people all over the world can lead healthier lives.
And as Ambassador Lange said, so this means we need to prepare for the next pandemic, respond to this one, and again, address that basic routine immunization. And really wanted to as you think about talking to the congressmen or staffers and other stakeholders, to really, almost give yourself a pat on the back a little bit, and the work that you've already laid and the groundwork in advocating for immunization, and how that has led to the U.S. leadership role that it has in terms of laying the groundwork and the good work that's helped to pre-position countries to respond to COVID based on some of those immunization activities that have taken place.